Welcome back. Rare diseases affect nearly 30 million Americans each year, and there's one progressive kidney disease known as autosomal dominant polycystic kidney disease. It's the most common rare inherited kidney disorder that you've probably never heard of. Joining me, nephrologist Dr. Meyeon Park, director of the UCSF Polycystic Kidney Disease Center of Excellence. Welcome.
Thank you so much for having me.
Appreciate you joining me. So let's talk kidneys. What role do they actually play in our overall health?
The kidneys are vitally important for overall health. They filter the blood and keep important substances in the body while excreting wastes. They also regulate the blood pressure and manage certain other hormones that are crucial for body function.
Which means we should really be paying very close attention to the health of our kidneys.
That's right, I think so.
What is autosomal dominant polycystic kidney disease, and how does it affect kidney function?
Sure. ADPKD, or PKD for short, is the leading inherited cause of kidney disease and the fourth leading cause of kidney failure in the United States. And what happens in this disease is that cysts form in the kidneys and overtake the kidney, such that over time, the cysts grow larger and larger, overtake normal kidney tissue, and cause the kidney function to decline. A normal kidney is about the size of a fist, and in autosomal dominant polycystic kidney disease, as the cysts grow larger, the kidney can enlarge to be as large as a football, if not larger.
And what are some of the signs and symptoms of ADPKD?
In the early stages, it can be asymptomatic, but some of the signs and symptoms include high blood pressure, blood in the urine that may or may not be visible to the naked eye, kidney stones, and as cysts grow larger over time, there may be more back pain, flank pain, or abdominal pain.
How is ADPKD diagnosed?
Kidney imaging studies such as ultrasound can detect cysts, and these may be ordered due to suspicion in the context of a family history. Also, blood and urine tests may be abnormal, and imaging studies may be ordered in order to determine the reasons for those abnormalities in blood and urine tests.
And how's the disease managed?
Fortunately, due to advances in our understanding of the disease, there are a variety of management strategies that are available to patients now. Discussing these with a kidney specialist would be important to have an individualized approach for affected patients.
So, if someone suspects that they might have a problem with their kidneys, what would be the first sign of a potential issue?
The most important signs and symptoms in kidney disease in general tend to relate to blood pressure or to abnormalities that can be detected in blood or urine tests. Symptoms such as back pain, flank pain, or abdominal pain are more specific for polycystic kidney disease specifically, and incidental back pains and flank pains tend not to be diagnostic of kidney disease in general in most folks. Seeing a doctor and having blood pressure checked and blood and urine tests checked is the most surefire way to ensure that one's kidneys are healthy.
And is this urine test something that would be included as part of an annual physical?
Definitely regular routine blood tests for overall metabolic function do include kidney tests. Urine tests are also an important initial screen to see whether or not there is any abnormality in terms of blood or sometimes protein that can leak into the urine. So kidney health, I think, generally can be assessed by relatively straightforward blood and urine tests as well as blood pressure measurement.
So, because it's an inherited disease, are there other underlying conditions that might be associated with PKD?
So it is an inherited condition in that an affected person has a 50% chance of passing it along to his or her son or daughter. But sometimes this disease is actually diagnosed in a new generation, meaning that there is no family history that is known about, or that this is the first person to be affected. There are associated conditions with autosomal dominant polycystic kidney disease that are the result of systemic complications of the disease. These can include liver cysts, hernias, brain aneurysms, some other rare complications of ADPKD that are associated with systemic manifestations of the disease. Heart disease is also a very common condition that can occur in polycystic kidney disease, or in fact in chronic kidney disease in general, meaning depressed kidney function of any cause.
This has been really interesting. Where can we go for some more information, Dr. Park?
On behalf of Otsuka America Pharmaceutical Inc., I would like to direct you to pkdinfo.com to learn more.
And as always, be sure to check with your doctor or healthcare professional. Dr. Meyeon Park, thank you so much for joining me.
Thank you for having me.